Thanks everybody for joining us on this call. And this is another sort of update on the youth program guidance. And we had a call, I guess, I don't know how many weeks ago it was now, 2 or 3 weeks ago, when we had updated our county guidance in anticipation of the school year starting, and with the updated state guidance for sports and athletic programs. And since then, this last week, last week, the state announced their youth program and childcare guidance, their updated guidance. So we wanted to get everybody back together because we're updating our guidance. And I think it should be on the website right now. Let's see. The other thing we're also doing is sort of transitioning to this new framework that the state's adopted as of Friday, where we're currently tier 1 and we're going to be tier 2. And I think Lisa will talk a little bit about that, and we can get into that in greater detail because a lot of you who manage recreation programs and programs for adults, that'll also change some things for those programs as well. So with that, I'll hand it off to Lisa and we can get into more details and questions and discussion further on.
Thanks, Max. And as always, thanks for being you. I'm Lisa Santara, Deputy Health Officer for the County of Marin. I'm going to share my screen and just walk you through a quick update of where we are and in just rates, et cetera, in Marin County, but also more importantly, to show you the new framework and how it'll affect us moving forward. We're very excited about the new framework. We were proud in Marin County in March to be leading the state and establishing the shelter-in-place guidance. And Max and many others, and probably many of you on the call, worked very hard to develop guidance for the different sectors. And that was because we didn't have a state framework or a national framework to work off of. And so now we have a framework that the state has introduced that will allow us to move forward and backwards. That's something to be prepared for as much as we are moving forward with reopening, and we're optimistic about the reduction in case rates that we're seeing. That's going to allow us to move we're expecting to move into tier 2, which is our red tier. We are keenly aware that every time we reopen, there's increased risk for COVID-19 transmission, and then the increased risk of re-entering a second wave of COVID-19 activity. So again, this is not, as much as this is an optimistic presentation, I just also caution as we are looking at moving forward and getting lower in our tiers, there's always the risk of returning, but there's also defined mechanisms now for returning back up to a tier 1. So this is just an update you probably have seen. We now have over 70,000 people tested. This is an important number because our rate and our placement on a tier is actually connected to our testing rate. We receive credit for having high levels of testing in our community. On any given day, we have one of the highest rates of testing per capita, and that is going to be adjusting our case rate that is seen on a state level. So that's important for us. And just to always to be aware that the reason why we do all this, because people do have adverse outcomes and are hospitalized and do die of COVID-19. We've seen more people die of COVID-19 than of the flu. So this is something serious in our community and why we have invested so much time in our partnership with you guys. So this is data I've already shared. I think everyone already knows that it's a 50-50 disease. It's affecting men and women equally, and it affects older adults much more than younger adults. But we know that our community is inextricably linked, that there's older adults who are caring for children in childcare programs, and why, again, this is, again, just, even though we're thinking of youth programs and youth activities, we are also very much aware that many of the staff would be in populations that are at greater risk for hospitalization if you're over the age of 50, and at greater risk of death if as you increase over the age of 80. Though in Marin County, the majority of deaths are not directly engaged in childcare. It's those who are living in our congregate facilities, especially for the elderly. And this is our story in Marin County as well as across the nation, is just the disparities that we see where the Latinx community has been experiencing higher levels of COVID-19 transmission, driven primarily due to low wages and crowded housing conditions that many of members of this community are experiencing as we move through this pandemic. And so jumping forward, and I'm going to go faster because I want to make sure there's time for questions and answers. Not that I have all the answers. It's been a task. We've had multiple lawyers with Max and I navigating these phone calls, trying to see the Venn diagram of schools and youth sports and childcare. And we've developed an FAQ that's available, but we'll learn probably from today where you'll have a great question that we haven't considered ourselves. So it's us trying our best. But this is where you can go right now. It's called Blueprint for a Safer Economy. You'll be able to plug in Marin County and see our actual status and the activity. And they've done a much better job of, again, defining the different sectors of activity and where we are based on our current tier, which is, again, tier 1. These are the features of the new blueprint, which we are excited about. As I mentioned earlier, Marin County with the other Bay Area counties was leading the way in sheltering in place and working with many county councils. A lot of lawyers are in the room trying to define, align science and law in order to define a framework for sheltering in place. And then as we started to reopen, the same teams were working together to really provide guidance for reopening. Now we don't have 58 different sets of rules. We're working together in concert with all the other counties. We're functioning now under statewide orders, and all the metrics that we're using are consistently applied across all of the counties. So this standardization is key for us moving forward. It also has a much more slow progress, so we have to maintain our success, I guess, maintain our status for 3 weeks before we can ever move into a new tier. So it's not just a reactionary framework. It actually is showing we need to be able to demonstrate sustained improvement before we can improve to another tier. This is not just an open shut phenomenon. Now they have provided these 4 different tiers. There's actually 5 tiers. The last tier is the green tier when we end this pandemic, but that's not even presented because I think, again, just remembering this is a marathon. And in 2002, we saw SARS take around 2 to 3 years to clear. And so that's what I think many public health folks are cautiously optimistic that we're looking at a 2 to 3 year run. But we still don't, this is a novel virus, and that means that it's unknown to us. But this progression is much better than the open close. They use the term dimming. So we may need to, rather than being an open shut phenomenon that a lot of us experience, and that was jolting, especially to the economy and to local businesses and business owners like yourself. This is more of a progression. And then also it's responsive. And I mentioned it earlier, just as much as we can open, we can also be closing based on the local conditions. With all that being said, our goal is truly to align with the state. So when you go to our website in the future, you'll be seeing redirections to the state website, but the health officer always has the ability to be more strict than the state based on local conditions. And so that's not something that we're planning for, but it is in our back pocket if needed, if we're seeing that the state is not confirming that we're moving into a tier when we see conditions deteriorating in Marin County. Dr. Willis can execute additional orders on his discretion as a local health officer. So these are the 4 tiers. Like I said, we are currently considered widespread, and you'll see another slide because you'll see the data is not consistent with the numbers of widespread. And that's because we need to show that we've been in the tier 3 or substantial category for at least 3 weeks. So we're still considered widespread, even though our numbers look substantial or in tier 2, because we haven't demonstrated 3 weeks of consistent data. And so you can see where the state is. It has around 10.9 cases per day per 100,000 persons. And that's a little bit different. Some of you may have been tracking a number that we were saying we had, for example, 112 cases per 100,000 people over a 14-day period average. So now they're looking at a per day rate. So it's shifting down. And to be in the substantial rate, you need to be between 4 to 7 new cases a day and have a testing positivity rate. So the number of tests that test positive between 5 and 8%. And so this is, if you were to go to the website today, this is where you would see where we are at. I call it the Candyland graphic because it reminds me of the Candyland squares. So if you look at Marin County and you hover over it, you'll see that our case rate for the week ending 8/11 was in the purple zone or the widespread zone, but our test positivity rate was in the moderate zone. And so it takes the worst of the two metrics. It doesn't average it out. So that's why right now we still are in the purple zone. We are at the week ending 8/18, you can see our case rate was in the red zone, and again, our test positivity rate was in the orange zone, which is reassuring. And if they'll be looking at the data for the week ending August 25th, and they'll be looking at that data tomorrow and through the weekend. The reason why it's a 7-day lag is because it takes time for lab results to report into the CalReady or state system. So we anticipate, it's not been confirmed yet, but we anticipate come September 8th that we'll be moving into the substantial risk tier. So, or the red tier 2 or the red tier. And that's gonna allow, oh, wrong presentation. Oops, sorry about that. I shortened a presentation. This is the one I wanted to share with you. Same presentation, I just edited out the other things. All right, anything you want to add, Max, before I jump into the actual tiers and what they mean and then move into childcare?
No, I'd say go ahead and jump into it, and then we can always
perfect.
Elaborate.
So this is where it gets a little bit shock and awe. I try to just pull out the activities, again, thinking as a mom and different activities that were connected to childcare activities and youth programs, which haven't been operating as normal, but just with the awareness that there's certain activities that are interconnected with our childcare and youth programs. So as you know, in Tier 1, we have childcare is allowed to be open with modifications, and we'll talk about those modifications. Gym and fitness centers are outdoors only. Indoor playgrounds remain closed. Libraries are allowed to be open with modifications around capacity, and that's, again, speaks to the progression that you'll see that some sectors are able to open, and it's depending on where we stand, how open they can be. And Tier 1 allows schools to be open with modifications if approved by California Department of Public Health and the local health officer. And there'll be a press release today announcing the schools. We have 14 schools that have been approved by the state and our local health officer to open for in-classroom instruction as early as September 8th. So some schools will be returning to the classroom on September 8th, and we are very excited about that next step. We are building our school and camps and youth activities team of nurses. We've been meeting regularly to have a system. We've seen early successes in countries like Uruguay, where they have strong public health infrastructures, and that includes having public health nursing that can quickly identify which cohorts need to close, and some of you have already been working with us on those. So that's where we are now. This is where we expect to go on September 8th. It's not yet confirmed. It should be confirmed as early as Friday, and will be published on Monday or Tuesday. We're still seeing when the state is published. Do they publish it at the end of Monday or publish it on Tuesday? So that's still to be seen. Dance studios, we see a lot of emails around dance, but dance studios will be allowed to open, but it's at 10% capacity, which we appreciate as much. Does not necessarily meet the economic or business picture of what dance studios need to operate at, but it's a risk-based approach. So dance studios will be allowed to open, as will gym and fitness centers, again, with that 10% capacity. Indoor playgrounds remain closed, so no jumping ball places and trampoline places yet. Libraries, you'll see it increases the capacity in red. So we go from libraries being open at 25% to opening at 50%. Movies will be able to open. This is where sometimes they set the percentage as a capacity, or they have it set a fixed number. So for movies, they set a fixed number at 100. Museums can open. And then this is a very important one for Marin County. So schools can open in Marin County as long as we stay in the red zone for 2 weeks. So that means effective September 22nd, schools are allowed to open without a waiver in Marin County. And that will be up to individual schools and districts. And it's being driven primarily by labor conversations with laborers and individual schools and districts. That being said, in our waivers, there are both public schools and private schools that are going to be operating under a waiver effective September 8th. And I think I hear a lot of questions around that, where we feel reassured is that all of these schools have developed very strong site-specific protection plans that will be in place. The measures that we have as a community are very strong in requiring the use of face covering and maintaining physical distancing. And these are, again, out of an abundance of caution to mitigate any risk of COVID-19 transmission in the community. We've had many reports all summer long of staff testing positive and sometimes camp participants testing positive. And the reason why we're not seeing disease transmission when people are exposed to COVID positive individuals is because we're creating conditions where there's very low risk of close contact between someone, even if they are COVID positive and presenting as an asymptomatic individual. We are creating conditions that really reduce the risk of COVID-19 transmission. And again, that's what we'll be tracking as we reopen. And that being said, we are moving into Labor Day weekend, so there'll be another press release. We saw what happened after Memorial Day weekend, and we saw what happened after 4th of July. We see surges in cases because people start socializing more. So again, for us to maintain in tier 2, if we get there, really depends on encouraging participants in your programs, parents in your programs, that they need to limit their social activity. Every phone call that I get that's usually connected to a case is that someone went to a wedding or a family function, and then they brought it back into their work environment or a school environment. So really, it's us working together by limiting our social activity and not engaging in gatherings. So this is not new to you. I think on the phone call, you can be open for operations as childcare establishments and youth programs, and you need to have that site-specific protection plan. The templates are available for you. This is where we start intersecting with the state in different guidance. Youth programs that include sports may operate, but they need to operate consistently with state guidance. That means physical distancing and maintaining that stable cohort. What has been removed is we had a 3-week minimum. That requirement is going to be removed in our FAQ. You'll see it removed in our FAQs because this is one area where, for example, we're going to be aligning with the state. Indoor youth sports are not allowed. They will be allowed to operate if we move into tier 2 next week and at that 10% capacity. And so we'll share this presentation with everyone, but these are the links, just making sure you're aligned with the state guidance on youth sports and their FAQs. Indoor pools will not be allowed to open until we move into tier 3. And when indoor pools are allowed to open, again, children need to stay within that cohort and follow the guidance where it relates to pools. So cohort size has been a big question around reopening with childcare facilities. Just framing this is that we, of course, are deferential to licensing. Licensing is the overarching body for many of the programs that are on this phone call. And so we, of course, will defer to licensing. I know that some programs have already reached out to licensing to get waivers for how they're going to be operating. So that's a process that's in place. We really, again, the goal is to have as stable as a cohort as possible. When we maintain stable cohorts, then we reduce the risk of transmission in the community. This is the first change from our initial guidance. And again, this is when Marin County was leading the way in creating guidance, and we selected 15. The state opted for 14. So this is an area of change. We will be following the state guidance and reducing cohort size from 15 to 14 children. It's really important to recognize that this is for childcare and youth programs. It is not guidance for schools. Schools will be able to open under their waivers following the 30-point public health guidance. So this is a place where schools are different than our childcare and youth activities. So in childcare and youth activities, we're maintaining a stable cohort of 14 or fewer. Classrooms can open up maintaining the distance as recommended by us of up to 25 children in a school classroom. That is different. We do not see any change in aligning childcare and our school guidance. I anticipate that they'll remain the same. I don't see a change coming from the state. Again, the goal is to have as many few households as possible. So we want as the same kids from the same household and the same cohort if possible. Also, we don't want children cannot attend more than 2 childcare or youth programs simultaneously. There is a caveat in in allowing in the state guidance that allows one-to-one specialized services by a support service provider, which can include an attendant. So the example I've shared is that, for example, my children are in a cohort of 13, a childcare cohort of 13, and there are an older group of kids that are pretty self-sufficient, the third grade and older, as they're engaged in virtual learning. But there's younger children in the kindergarten and first graders who are engaged in virtual learning. It would be allowable, how we are interpreting the state guidance, to have an additional adults who would be considered attendants or supporting that one-on-one support for example, a kindergartner who needs additional support for virtual learning in that space. So that's how we are interpreting that. But of course, if you're a licensed child care facility, we recommend you contacting state licensing to review your plans for using additional support service providers in your cohort. And then the other guidance that this references, again, is that small group guidance on the state. Our awesome county council did their best to review all of the guidance and to try and provide in the FAQs that are posted to our website their interpretation. It might not get to the nuanced space that you need, but we really tried our best to understand and kind of triangulate the small cohort guidance, the youth sports guidance, and all the different guidance documents that are out there. And then this is all the guidance that we reviewed. So you'll have just the links to all those when we share this presentation. And that is it. Like I said, I wanted to make sure there was enough time to get through some of the nuanced questions that you might have. And I'm super thankful Max is here to help me navigate those questions.
Thank you so much, Lisa. And before we get to the questions, I just wanted to add, so the Marin Recover site has been updated, and I am just, let me see if I can just share my screen, or maybe I can't. It's okay. If you go to the Marin Recover site now for childcare and youth programs, you'll notice that basically the old the guidance that we had there is no longer there, and it's just a very short sentence, and then it has links to the state guidance. And I think we're going to move almost all of our guidance to that same style, which is just deferring to the state. Oh, good, Lisa's going to share it. So yeah, if you scroll down there, you'll see that there's that reopening guidance. It just has those links there to the state. And then a huge thanks to our county council who did a bunch of work to put together this FAQ that's below, because I think probably for a lot of you, but definitely for me, when I read the state guidance, there were a lot of things I was not sure about. And so we tried to provide some clarity to some of the places where there was some issues with the state guidance. And I think, you know, the other thing for a lot of you, just as a heads up, I think we're probably going to defer to the state guidance also for outdoor recreation, you know, for adult groups. So many of you that have adult group programs, the state has guidance in two places, both it's under fitness. Their website's similar to ours in that it has a bunch of different categories and then drop down menus and then a link to the specific guidance, but both in fitness, and then it's like called camping and outdoor recreation. And they have a lot of similar stuff that we do around like golf or aquatics or different things like that. And so we'll likely be just deferring to that, but it won't go into effect until the 8th. But just as sort of a heads up of where we're going. So with that, maybe we can get to some of the questions. And I've been trying to answer these in the chats as we go, but let's see, what have we not gotten to? What are the state guidelines from Danielle? What are the state guidelines for 3 weeks at a time? So and Lisa, correct me if I'm wrong, but my interpretation of the state is that they define what a cohort is and they say that it needs to be stable, but I don't think they give a specific length of time.
The 3 week was a Marin County phenomenon creation, and that was the intentionality around that was not having children pop. One of the Marin County tradition for some parents of privilege was having kids pop from camp to camp to camp to diversify their camping experience. And that was the intention behind when we created a 3 week minimum, which we knew was a burden for some families as well. There's always unintended consequences, was to not have the camp to camp popping as we were allowing this activity to reopen. So that is not part of the state guidance. So that we've removed that as part of our requirements, that participation would be has to be at least 3 weeks. So that's no longer in effect. Again, the goal though is just around education, is we really want to reduce intermixing of cohorts and want them to be as stable as possible.
Right. And I think, like a drop-in class or something probably wouldn't meet the metric of a stable cohort.
No.
Let's see. And then a question about 15 kid groups, breaking them into two, but two distinct spaces are difficult. Yeah, so it's, I think, and sorry for the challenge. I think we were trying to get ahead of the school year with coming out with that 15 number. And, it's unfortunately, it's, one person higher than the number that the state came out with the week later. So, yeah. And so unfortunately, folks will have to sort of figure out how to switch to that 14 number. And I know that's difficult. And then let's see. So does the indoor sports capacity refer to the capacity of the gym or whatever room they're using? I assume that would be the same thing, like that there's sort of a standard fire code capacity.
Yeah, it should be for the room and for the building. Again, whatever is the less, in the sense that we really are trying to minimize the number of people that are in a singular room. There's going to be, you'll see there's increasing evidence around the airborne transmissibility of COVID-19. So if people are exercising in a small room, the more people, again, our prevalence is low. So the likelihood, what's happening in this, why we're moving up, is that we're seeing a lower prevalence of COVID-19. That's why our case rate is going down, our testing rate is going down. So the probability if you have individuals in an indoor room of one of them being positive for COVID-19 is lower, which is why it's being allowed, but there's still that risk. And so we want you to just err on the side of caution. If it's 20 people can be in a room, it really should only be 10% of 20, which is not a lot. And so I think that's going to be the business challenge. And again, we appreciate that 10% is not a lot. If a room normally held 20, again, I think all of us have experiences with using indoor facilities and know how challenging this will be, but that's the intentionality. And especially now that it's the temp, I know we're in smoke land, but as the air quality improves, really trying to maximize our time outside is always going to be the best strategy.
And then I saw here, can adults cross cohorts? And if so, how many cohorts can they be a part of? I think if you read the state guidance, the way it sounds to me is like, if adults are like substituting, or, there's a bunch of sort of scenarios that they sort of outline for how adults might end up serving multiple cohorts, but that, they're advised not to, to have adults stay with the cohort as much as possible. And I think, as you're planning the main person who will be teaching a cohort, that person would just be teaching that one cohort. Does that sound right, Lisa?
Yeah, and I get the intention is really, one, to minimize the number of movement across cohorts as much as possible, understanding that it's not feasible. You have people that are absent, you have additional needs. And I saw that come on, and again, is the clarification around the number of adults. I think that's where an example is that you can have other support service providers. For example, in youth activities with special ed populations, it might be possible that each child needs a one-on-one attendant. That is possible. It would be a much larger cohort, but the state is allowing that one-on-one specialized supports as kids may need it. So you could have 4 adults in a cohort with 14 if 2 children need one-on-one specialized attention, or the 4 kindies in their virtual learning need one-on-one attendance. So again, we're trying to minimize it as much as possible while supporting the environment, the learning environment.
And then are masks required outdoors during exercise for students in a dance class? My understanding is no, they would not be, they have to be 6 feet apart, but they would not be required.
6 feet apart, mask not required when outdoors or when eating.
And then let's see, state guidance for small cohorts, groups of children and youth says it applies to indoor environments. Does this mean that teachers can teach multiple cohorts if necessary for outdoor youth sports activities like dance outdoors. I'm reading that guidance that it's for all youth activities, and if it's not indoors, it's outdoors. Lisa, do you read that differently? Or
No, I read it the same way.
okay.
Again, we're
And-
trying to, the goal is again, trying to minimize the cross populating is the word I'm looking for, of different cohorts. So the more we can keep it stable, the better for everyone. Knowing that, again, in some business operations, in some, it just might not be practical or feasible. So regardless of indoors or outdoors, the more we can create stable cohorts with the least amount of folks, the better. And again, it's the hard thing to, I know there's like dissonance in the brain where it's going to be different in the school environment than it is in these youth activity, childcare environments. And that's just something, that's where we are now. And again, I don't see us reconciling that or the state reconciling. There was a time we thought that the state might allow up to a higher number, more consistent with what would be allowable in a school setting. So for example, in Marin County, you can have up to 25 kids in an elementary school cohort is allowable. That's not what's going to be happening in the near future with childcare or youth activities. That number is not going to be increasing.
See, and then I see as of September 8th, will we need a new SPP? I think you just need to update your existing SPP to utilize that new guidance.
Right.
And then what would that mean? Could somebody be added after the start of a cohort? I think potentially they could, right, Lisa?
Like, so example, a childcare only has 13 and as a new student arrives, they can add another child. Again, the goal is just keeping that cohort stable.
If a program started this Monday, can a new child be added to the cohort tomorrow?
Yes.
Yeah. For youth sports, do we know what tier must reach in order to move skills from drills only back to team competition? That's a good question. I haven't looked. I'll look that up. Well,
yeah, I didn't see. It looked like tier yellow, which is tier 4, was when that higher level of activities allowable. But I don't think they adjust. I don't believe the state has adjusted its youth sports guidance, and I just reviewed it before I jumped on, but not deeply enough, obviously, to align yet with their new tiered system. And when I reviewed it, I didn't see them comment on when it is allowable. So.
Yeah, that's right. So I just looked at it. I think it doesn't, there's no date that it's specifically allowed. It's just the same youth sports guidance, no matter what tier you're in. It's just
and there's 2 counties, it's only Alpine and Modoc, I don't know if I'm pronouncing it right, that are now in that tier yellow. And so we may see the state provide more guidance as those 2 counties start asking questions to find what's allowable. Because again, that's what often drives updates and guidance is when questions start coming in. So we might be learning from the Modoc Alpine, although it's more lower populations, of what becomes allowable in the youth sports and when.
Yeah, and then here's from Danielle. I read in the state guidance that each cohort can only have 2 teachers, coaches, instructors. What if we need a substitute or similar situation? Do you have any feedback? So yeah, I think there's, a little wiggle room. If you need a substitute, that's in there. It seems fine. And then also if kids need like special support, there's the ability to have an additional instructor or coach for special support.
Yeah, especially as we want to ensure that activities are as inclusive as possible. So for children, with some special needs or developmental delays or other disabilities, the way I'm interpreting from the state, if you can provide those activities but need an additional staff to make it to ensure inclusivity, which is a priority for us, especially for those with access and functional needs, that absolutely is the spirit of the law is inclusivity, ensuring full access and not to exclude just because there might be additional, again, those, for example, individual students with individualized education plans might need more that attendant level care. And so we want to be as inclusive as possible.
And then here's one from Diane. If a youth group comes with leaders, are they including in the 14 count. So I think what I'm hearing is like, so if you're a kayak operator and there's a school that comes and they already have like 2 leaders in their group, then to me, it sounds like maybe they're actually operating the youth program and you're just providing an activity for that youth program for that day, and you're not actually operating the youth program. Does that sound
Yeah, I would
right?
see them outside of the cohort. Like, for example, there might be staffing that's required to provide the activity, but they're not interacting with the cohort who's coming on site. So I wouldn't be adding to that 14. The group would be the intact cohort, and whatever the facility needs for the operations would be outside of that cohort.
So can you hear me?
Yeah.
Yeah, we can hear you.
Great. So just to extrapolate a little bit, like Et Cetera works with agencies a lot. So let's just say an agency comes with a group of folks with visual impairments, we'll just say. And they have 2 or 3 leaders that come with that group, but then we're going to provide kayaking for them. And so then we have our instructors. And so that's separate. But my question is, are their leaders included in the 14 count? See what I'm saying? So you might have youth, let's say you had 14 youth. Could you have 2 of their leaders on top of the 14?
I would say yes, if that's what's required for the supervision of that cohort.
Okay.
Yeah. So you might have 4 instructors.
Right.
They're part of your team. They
Yeah.
might have 2 adult
Leaders.
leaders and 14 students, and then you are kayaking together.
Right.
And just hopefully their group is a stable cohort that they work with all the time, and this is like one activity that they do or something. Let's see. Oh man, this is a long one here from Kate. Kate, do you want to just jump in and ask this question?
Oh, yeah, no, I was just, I just, what Amanda was asking about the indoor activity, it's just that the first paragraph of that guidance that's from the state says controlled, supervised, and indoor environments. And so I just wanted to absolutely make sure that outdoor environments don't have different criteria, because it seemed strange that they would put the word indoor in this thing and not if it's meant to be for both.
Specifically in terms of the teachers that are teaching the different classes, because I know all the dance studios have teachers teaching classes, different cohorts.
Yeah, I don't know that I saw like a different set of guidance for outdoor youth programs.
No.
So this is the only set of guidance I see for youth programs. So it's,
That's what I figured. I just wanted
take
to
it.
double check. I wish they wouldn't put in crazy words like indoor when they don't mean it, but you know what?
A lot of lawyers reviewing this, and yeah, it's hard, and we appreciate it.
You guys are doing great.
Yeah, it's hard to navigate these different spaces when they've all been created at different times. And I think what this recognizes, we're getting closer to having more clarity, but it's not all the way there yet.
let's see, any idea what the definition of same space is? Forrest, do you want to jump in and like explain what you're asking here?
Yeah, sure. I mean, this has been a kind of a constant thing. We've been running a big youth program all summer long and very successfully, knock on wood. But with the change from 15 to 14, we already sold into 15-person groups last week. And now that would require us to split those in 2, whether it be 5 and 10 or 7 and 8, however you want to dice that up. But they talk about, having 2 groups in the same place with very, very little definition. I mean, what is the same place? If everyone's distance 6 feet apart, you're by definition not in the same place. So does that mean, in the same parking lot, or does that mean within 10 feet or 30 feet or the same dock in our context? Or do we just kind of not worry about it because we're clearly not in the same space because we're all 6 feet apart anyway, in theory?
I think what you don't want is the 2 groups interacting. So that you're gonna have activities where the kids are interacting, and so you want to just keep the 2 groups separate enough so that they're not interacting throughout the day.
Yeah, so more specifically, I mean, we have a dock, we run a sailing program. We were going to have 15 boats lined up. Now we're going to have a big red line of duct tape down the middle of the dock and have 2 groups on it, right?
Yeah.
Yeah.
I think
Same
how you're
space, but same space, but smaller space. So thank you. Just, you know,
And I
make
think
sure we're going the right way.
yeah, just try your best.
Yeah. Thank you.
Let's see. So if an instructor teaches a program on Monday for cohort A, they cannot teach a program on Tuesday for cohort B. I mean, I think the way I read it is like if the teacher for cohort B was sick, then the teacher for cohort A could substitute into cohort B to help out. But that, you know, the state's trying to recommend that you don't just plan to have the teacher teach 2 cohorts. Let's see, the new maximum group size for outdoor recreation was 12 for adults. I'm not seeing a size limit on the state guidance. Yeah, so I think that's potentially, I don't know that we've like completely finalized that yet, but potentially we're looking at getting rid of the size limit for adult recreation guidance because the state does not have a size limit. Thank goodness for duct tape. Okay, so it looks like we're at the end of those questions. Feel free to like jump in if folks have questions that they didn't put in the chat.
Max, this is Danielle. So just a couple of, for me and what I'm hearing is, so if you have a dance studio, you can reopen classes if you have 15 teachers to do the 15 classes, right? Because normally dance studios would have 2 instructors and run 15 classes. Am I reading that right? Or for gymnasiums, same thing?
That sounds right. Yep.
Okay. Just wanted to clarify that. Thank you.
But I'm just thinking in my head, I guess you're right, because I'm used to a different scenario where it's the teacher base is more stable. And so for example, it's not dance, but they're running 6 classes back to back and using two teachers for those 6 classes back to back, which is not happening now because everything's been scaled back. Is that, would you normally have 4 separate classes and 1 teacher doing those 4 separate classes? And that's what you're concerned about, that you'd ideally like that 1 teacher to be able to still do those 4 separate classes. And with the way you're hearing us interpret it is that teacher can't do those 4 separate classes.
Well, mine would be more specific to like when gymnasiums are allowed to open up, when we get there, you usually have like the main instructor who runs the gym, and then they have like maybe 2 people that work with them, but they run the gym all day long, or they run different programs all day long. So it sounds to me like they wouldn't really be able to open because they could only interact with, maybe 1 group on a consistent basis.
I hear that. So maybe we'll go back and clarify. We'll review with council this kind of specific scenario where I know your hands are tied just because of the facility capacity issue, but then it could be further complicated with just how your programs are designed. But we can go back and review with county council to see if we can update the FAQ to provide clarity there. I hear the challenge, and this is the nuanced space where trying to get businesses up as usual and minimizing cohorts are just a natural conflict. So I appreciate that.
And then my follow-up to that would be for adult classes. I think right now my experience is they're teaching maybe 1 or 2 classes, like a boot camp on a Saturday and then another one on a Sunday. So they're interacting with more than 1 cohort. Mm-hmm. So it's kind of the same question for outdoor adult recreation.
Yeah, and I think this is where it goes back to the yacht club is like, well, if everyone, there's part of this is that as we shift how we do things, and your instructor, it comes up in our conversations with the schools all the time, ideally with the site safety plan and people staying 6 feet apart and just having that thoughtfulness, the harm reduction is already happening. And so implementing a little bit harder in an indoor dance scenario when people are sweating and breathing and huffing and puffing, that's one of the challenges that we now know, that there is this
airborne component to this. And I think that we'll just definitely go back. Again, part of our goal and having Marin covers and having this space is it's written a blueprint for a safer economy. And that also means you need to be able to have sustainable business practices to stay in business. So I really appreciate all of you just being so strong and pushing through and trying to find these silver linings and the spaces to continue your business operations. So we'll go back and again, especially as we start being prepared to move indoor, making sure that we're providing our interpretation on this indoor spaces and finding the way to navigate that. And also to advocate at the state level as we start reopening, because some of it might not be, we're providing guidance that doesn't make business even possible. So we'll try and again revisit that.
Thank you.
And I think so. One question was, it is true that the adult guidance, an adult could teach for adults, 6-7 classes in a day to 7 different groups, and adults can do drop-in classes. There's no requirement for a stable cohort. And so I think, there is different guidance for the youth versus adults.
Yeah, and we'll try, and again, that's where I'm just being honest, like us even just trying to catch up with this, even thinking as a clinically and trying to be compliant with the state, as also trying to be reason-based and logical, and having common sense it's a challenge. So our commitment is to get to a science-based, common sense approach that gets everyone back in business and starts creating a healthier environment while still not putting ourselves at risk for going back into purple. So that's, I think, and that's why these sessions are really important, because we can hear from you. And then Dr. Willis and I do have a place where we can provide this information back to the state so we can learn how to do this better.
And then question from Sean here, do we know what tier playgrounds are? So yeah, there's a few things that are just not allowed by the state, and like playgrounds are still closed. And then I know one question that's come up in other calls is like gatherings or events. And so far events and gatherings are, I haven't seen that they're allowed in any of the tiers, maybe at the very end or something. But yeah, there's some of that stuff that just doesn't have a path for reopening yet.
Matt,
yes. Yeah.
question. In terms of West Marin, because pretty much everything's closed down right now because of the smoke.
Mm-hmm.
In terms of, Point Reyes area, West Marin in general. It seems like state parks, county parks, and national parks are all going to remain closed for now. Is that true? That's my understanding.
I don't know. My sense, I guess my best guess, and this is actually maybe more of like a, it has to do with the fire. I think the last firing operation is either today or tomorrow. I know for our, we've been supplying crews to support the efforts out there, and I think they're coming back tomorrow. And so, my, hope would be that in the not too distant future, some of the evacuation warnings can be lifted, and then we can reopen some of our, like the parks around Tamales Bay. I know that many of you utilize. So I'm hopeful that, I know that we've been trying to keep those closed to keep traffic from coming out towards the coast during the emergency, but that we're expecting, knock on fingers crossed, that like containment keeps going up and that we can reopen those pretty soon.
Okay. Yeah, I think that part of it too is just, even though there's greater containment, it's just the smoke factor, the air quality is not improving so much, at least out there, because of the control or the back burning that they're doing.
Yeah, and I think there's likely to be some interiors, smoke generation for probably, I think, like weeks or months, but I'd have a feeling it's a lot less than what it's been. And I think our cutoff for closing parks due to smoke is that like 151 on that, that metric. And so, I think as long as it gets down below that level, then we're likely to reopen the parks, which I'm hopeful in the next few days we'll get there, but I don't know. I don't have a crystal ball. Let's
There's a
see.
question about the schools. Schools are for TK through 6 right now. So there's still, the state isn't allowing secondary education at this point as we're understanding it.
Huh.
That may change, but that's where we are now.
What, any other questions, comments? Let's see, where does the county stand on shelter-in-place travel guidance? So it is still a shelter-in-place order, but we have allowed hotels and short-term rentals to open for leisure travel. So I don't know, Lisa, do you want to add anything to that? I know it's confusing.
It is confusing. I think the spirit again is how do we keep limiting our activity as much as possible? And at the same time, knowing that people need to have travel. And I think it's how you travel and how people travel is that really encouraging people when they do travel to travel with only their social bubble. There's a lot of fantasy football where multiple households are now convening. So I'm not going to be surprised if we have, 2 weeks out from now, as people start, intermeshing their households again, that will have more cases. So it's again that back to that common sense is that yes, absolutely, travel is allowable. We have the CDC has lifted quarantine requirements for international travel. The quarantine requirements that you now see are state dependent. So for example, Hawaii, Connecticut, New York, New Jersey, they have restrictions on our travel because we're a higher prevalent state to those areas. And again, just encouraging your networks really to minimize their travel. That's how we're going to stay in the red. And that's my biggest concern, and is that as we move forward, again, people's vigilance decreases, and then your networks aren't staying in their social bubbles. And so the risk of the activities that you're providing that we want to provide in a safe way, the risk increases when your participants in your activities are not limiting their social activity. And that's what we're just so interconnected on this. We saw in July how quickly we went back up in case rates, and we're reopening again. We're going to be going, I really am optimistic that we will have affirmed from the state that we're going to be going into this red zone and more activity is going to increase, and then we'll be back in purple. And that's our greatest risk, is that this is a responsive tier, and we could be back to outdoor activity only. So we're really depending on you and your networks, really encouraging people to just limit their social activity, even though yes, you can go out and rent a house in Stinson Beach or Dillon Beach, or you can go to Lassen Volcanic National Park. That's allowable now. Not many people up there. Least visited national park, I learned, is the acronym for that one. But that's okay. But just protecting your social bubble and keeping us open. This is us together. And you guys have a lot of influence. You connect with a lot of families, a lot of members. The more you can keep encouraging them that you're going to stay open in business and you're busting your butt to get open and stay open. It depends on your members also protecting, staying small, thinking small.
Let's see, I think we have time for just a couple more questions. So is it okay for one teacher to teach just 2 cohorts a week? I think the guidance says teach 1 cohort, period. But you can, like, if there's substitutes needed or something else like that, then folks can teach another cohort for substituting or something like that. So that's my reading of the guidance. And then, safe number for smoke. So that's just for our county parks, is something that we put together a couple of years ago when we had really bad smoke. Is we just have 150 as the cutoff for when we close our parks in terms of the number for smoke. And that's going to be we're going to be in this wildfire season. This is our earliest we've been in it since I've lived here. And I'm just surprised. And again, another place to really, with your networks, I was shocked to see how many people, when I went out to Bear Valley, when they're still stationed there, how many people were biking and being physically active. So part of
It's not to have that split message of having parks open, but people are then going and hiking. So and I think that's also part of the reason for closing the parks at that 150. And people need to see sometimes those closures to take our guidance seriously, because I see people, I was again just shocked by how many people were out there active. And I think people underestimate the risk of smoke, that it actually can cause acute heart attacks and death, and we just don't know which person is going to be more susceptible to that increased risk for an acute event that is not just lifelong lung disease that we're looking at. There is a risk of acute events. So it's been a year, guys. It's been a year.
And I can send, for the parks folks, I can send you guys all the from the cities and towns our smoke plan for parks, if that's helpful. So I think that's about it. Thanks everybody for being on the call. Feel free to shoot me an email if you have questions after. Give me a call, and really appreciate everybody's help and support. And thank you, Lisa.
Thank you, everyone. You're helping us get there, and I appreciate your tenacity and grit, and everyone working together. We really are thankful for you, and are just so impressed by your spirit and sticking with it when this is a long marathon. So hang in there, and you're doing an awesome job. Thank you.
Thanks, Max.